Hi, I'm Meshal Malik and you're watching Indus Special. Experts are claiming that the dengue outbreaks witnessed in several parts of the world, especially in Southeast Asia, are the worst on record. Many regions are on high alert as the number of cases reported are quickly going up, creating alarm and strain on local healthcare facilities. On today's show, we discuss the factors causing a spike in these outbreaks. We also discuss what must urgently be done on an individual and institutional level to take preventive measures. Joining us for this discussion today is Dr. Uday Singh, who's a family physician and secretary of Nepal Medical Association. Joining us from Nepal, we're also joined by Dr. Qutbuddin Kakar, who's a representative of the World Health Organization with expertise in infectious diseases, joining us from Islamabad. Thank you both for joining us and welcome to the show. Dr. Qutbuddin, I'd like to begin with you. Now, we're seeing a rise in these outbreaks. What do you think is fueling this, especially in 2019?
Thank you for inviting us to this show. And I will just take back you to our history of dengue transmission in Pakistan. Since 1994-95, we had the emergence of this disease in southern part of Balochistan and Sindh province, Karachi particularly, and Hab district. Since that time, we had a period, of dengue-free period all over the country, till 2003 when we had the Haripur outbreak, followed by the Karachi and Lahore outbreaks in 2005 and 6. And since that time, we had this dengue, spreading, since disease, dengue is not actually carried out by mosquitoes, mainly, but it is, by the movement of the people, coming and going from and to those areas where we have transmission of dengue, where we have the vectors of dengue. Now the vectors of dengue have spread almost to all parts of the country, excluding some of the areas in Balochistan which are not well connected with the country, and the tribal districts. Some of them, they are not well connected, and that's why we don't have local transmission in those areas. The rest, we have cases from all over the country, and we will have this dengue, for a long time. We don't have such an history, that any country has eliminated this completely. So we have to live with this as it is endemic in Pakistan, and we may have these seasonal peaks and sometimes, outbreak situations in identified foci.
Right.
It's not
Dr. Kakar, sorry to interrupt here, but you've traced out how it's spreading within Pakistan, but we're also seeing the worst ever dengue cases in Bangladesh, in parts of India, in parts of even Central America. Now, given this point in time, I'm going to go back to that question. What are some of the macro factors which are fueling the rise in this, leading to more and more outbreaks, some of the worst ever witnessed?
The first contributing factor is the mass migration, the heavy, trafficking, the global travel, the local travel. We have the people, we see in Pakistan, they are traveling from Gilgit-Baltistan to Karachi. It's across the country. We have the people who are traveling from Lahore to Quetta to Karachi to Peshawar. And that's why, the people, they carry the virus, once they are in the first 5 days of the infection. And we also transport the eggs and the larvae of the eggs mainly of the vectors, and that's why once we have more transport and we have the local habitat, we have the climatic change. Like this year, we have more rains, compared to the previous 5 or 6 years. This was the heavy rain spell in Karachi, in Islamabad, and Rawalpindi. Even this morning we had rain. So that's why, this is one of the factors, the population movement. The second is the weather change, the climatic change which we have, increase in temperature and the humidity. That's one of the factors. The third one is the irregular water supply, in many areas. This is one of the reasons, as we go about towards the scarcity of water, safe water, the people, they store their water for a long time, and then they can't cover them. They develop such habit, and that leads to the breeding of this vector in the houses. So the breeding of vector, it is different in Lahore, in Defense, and it is different in the suburbs of Peshawar, because they have different habitat, In one, we have abundance of water, where the people, they breathe inside their houses, in the flower bases and other water storage.
And thank you, Dr. Kakar, for trying out the macro factors that are contributing to the rise in these outbreaks. But I want to jump to Dr. Singh and talk to him a little more about the symptoms and how people can identify whether they are have fallen victim to this disease. Take us through it. What are some of the warning signs?
Especially as we know that dengue is regarded as a breakbone fever. So the people, those who are infected, they usually get a very high grade of fever, usually more than 101, 102, and especially they have a very severe body pain. So it is a characteristic of other than other viral fevers. So you have very severe myalgia. It's called as myalgia. So it's a severe body ache, throbbing headache. So the headache will be very severe, and especially the periorbital pain. The periorbital pain, severe headache, sometimes vomiting, and even sometimes the patient, those who sometimes they have a very mild symptom like that of coryza, a running nose or a cough, but typically high-grade fever with body ache, periorbital signs. So these are the common severe signs and symptoms in a case of dengue fever. Apart from that, those who are in stage of hemorrhagic shock, they might have rashes over their body, and sometimes even more the patient come with a low blood pressure, so hypoperfusional states, a low blood pressure in a case of shock. So these are some common alarming symptoms of how dengue patients do come.
Right. And what should a person do immediately after they recognize these symptoms, Dr. Singh?
Especially our part of the world, like we have a tendency to have a over-counter the prescription OTC drugs. So whenever these people, they don't know they are having dengue fever, so they just go to a shopkeeper or pharmacy, and then for this body ache, they seek for a NSAIDs, the painkiller. So that's an important thing that we need to aware, that these persons should not take a painkiller. Just a paracetamol, a dose of paracetamol to relieving pain, fever will be the first thing. That as it is, we don't have any treatment for dengue. So just bed rest, plenty of fluids, and a paracetamol round the clock. And the person should immediately seek a doctor, a medical advice nearby, and should not take these drugs by themselves with a better option for those infected with dengue.
Right. Dr. Kakar, going back to you and talking a little more about how regions and countries are on high alert after witnessing so many cases, what do you think needs to be happening on an institutional level to deal with the crisis?
Yes, and this is actually the topic of discussion within our country. For the last many days, even the couple of weeks, we have been engaged with the authorities and the provincial capitals of Khyber Pakhtunkhwa, Punjab, Sindh, and where we have these focal outbreaks, in Rawalpindi and Pothohar town, in Khyber region, Khyber district and Bajaur district, and now we have situation developing in Peshawar as well. So the first point which you have pointed out is actually an institutional arrangement, that the government, the response should be on sustainable base, that will actually take the responsibility of not only the community involvement, but for the vector control and the capacity building of the care providers in the managing the cases. And that has to be done, on sustainable basis, that needs resources as well. On ad hoc basis, once we have the outbreak and then once we control them, it comes down naturally, because once we have one serotype, then many of the people, they are infected, only 20% they develop the symptoms, 80% they are asymptomatic, but they are now immune. So we have a window period, where we don't have dengue, when that's the relaxation period where we relax and we don't actually investigate, we don't actually strengthen our surveillance system, that is, very much needed, entomological and epidemiological surveillance is, to be done every time, and that needs a strong team at all levels, at district and at the provincial level. and that is very much needed. Without this, our response is only, on ad hoc basis. Once we have the outbreak, then it's finished.
And Dr. Kakar, as you've mentioned, that the response can only be on an ad hoc basis if this is the system, that's how the system is approached. The macro factors you mentioned, amongst them was climate change. Now, we will see worst manifestations with this in coming times. Do you think that this has a larger issue to do with how cities are being developed, the infrastructure issue that is leading to a rise in these outbreaks as well?
Very good question. I think I was coming to that, and this should have been the next question. First, we should have a body at our level. Government is putting all its efforts. They are spending a lot of resources as well. But I think, once having this is the next step. It's not the health department job alone, and that can't be done by health department alone. You are very much right. And that's why, we need intersectoral and intrasectoral collaboration with all line departments, with all the relevant sectors, without the involvement of water and sanitation department, without the irrigation department, without the public health engineering department, who are responsible for the water and sanitation and for the safe water supply, and that's the way, we have to do. Otherwise, only depending upon health, and just fighting with the doctors in such situation is not the solution of this, and that is why, we are working as one team now. And Punjab has a success story, that, and now Peshawar is also, they have done a very good job in 2017. So I think without, this is the way, to deal with this situation. Otherwise, alone health department can't do anything. And for that, a mechanism has to be developed, and that mechanism, is to be actually started from a body, within the Ministry of Health, so that collaboration should be initiated by the ministry itself.
Right. Dr. Singh, now towards the need for capacity building on terms with the healthcare sector as well with other departments. What do you think needs to be done on an urgent basis as more cases are, we're witnessing more cases and there is a burden on the local healthcare facilities?
I think the previous speaker, they have mentioned very properly regarding this strength capacity building. I think as we belong to a region where many of the people still they are unable to have like health facilities very easily. Though in a Pakistan, the health facilities are freely available, but in our part of world, I'd like to mention we don't have a health insurance, a fully active health insurance in our country. So many of the people they are unable, they cannot seek freely those services, and the dengue. The testing kits and all are very costly actually, and it's not so. So cost of a thing is the health facilities they should be provided in such a epidemic. The health institutions should be provided free of cost. All those like related kits and materials, those drugs should be available made, and those patients actually be made free to health services in our part of country where still the health insurance is not so actively implemented. So that could be one important thing. Next is the interdepartmental, intersectoral things should be like our the local authorities, the local development bodies. They need to make more awareness, not only the curative part but still preventive part has to be emphasized. So that is only one arrow that we can hit.
And Dr. Singh, on that point, because that is an essential point that we want to highlight, just mention some of the key things that are needed to be done in terms of prevention.
So actually, recently our government organization had conducted a research on a dengue. Actually, the Aedes aegypti mosquito there. Where they lay eggs. So they found that almost 62.8% of those Aedes aegypti larvae was found in a vessel where storage water has been done. And interestingly, it was found in two cities, namely Dharan and Pokhara, where it is very urbanized area. It is very urban place of Nepal, very a lot of people, they are migrants, they are ex these British army. So they have a very good houses, a lot of, they have storage tanks. And one interesting thing was that they have like Dharan, where the first epidemic began this year. It is a part of Nepal where water supply has very limited. So they want to store water for a longer duration. So that is one important cause, that they store water in storage tanks and these water pots and empty vessels and tires. So it's very rampantly thrown in the cities area. So those parts must be emphasized, that those ditches and those water pots or vessels, they must be emptied very properly. And one thing, very important thing, and then the next should be the proper, like we have to be self-protective devices, like we use very not only for dengue but for other bites as well, like malaria and all. We have to have protective measures be taken, like that, using mosquito repellent cream, using nets, using covering the windows and doors with the net, wear a proper clothing, so that bite has also to be prevented.
Right. And those are very important points that can, of course, be taken on an individual basis. On that point, thank you so much, Dr. Uday Singh, for joining us. And thank you, Dr. Qutbuddin Kakar, for joining us. We're going to take a short break. When we return, we take a closer look at how vaping is being linked to the rise in lung diseases. Stay with us. Welcome back. Now, New York announces a ban on all flavored e-cigarettes as vaping is linked to the death of 6 people across the country and the lung diseases which have affected more than 400 people. It's important to remember that these are only those cases which are being reported in the United States. As the number of people vaping increases globally year by year, experts are focusing more on what the impacts of vaping, which was once seen to be a safe alternative to traditional smoking, are. We take a closer look at this story. Joining us for this discussion today is Professor Atholl Johnson, Professor of Clinical Pharmacology at the Queen Mary University of London. He's joining us from London. And we're also joined by Mr. Todd, who is an activist and who has worked extensively on the vaping industry. He's joining us from London. Thank you both for joining us and welcome to the show. Professor Johnston, I'd like to begin with you. Now, given the rise in all these cases where more young people are being seen with lung diseases, tell us the science behind all of this, especially linking it to vaping.
Well, it's very difficult to know what the issues are here, and there's quite a few million people now vaping regularly, and this problem has only come to light recently. You have to ask whether something else is going on here, perhaps counterfeit vaping products, or whether or not people are making their own vaping products, or whether it's to do with not nicotine, but other drugs, for example, cannabis being in the vaping liquid, and that giving rise to the problem.
Right. A lot of people are linking what is happening to not to the vapor, but to the flavors.
Yes, well, I think that would be very true. And there's good reasons why perhaps we don't want to have flavored vaping anyway, and the fact that it might be more attractive to children and young people. And from my point of view, the whole point about vaping is to try and get people away from using cigarettes, and it's which is actually, I think, a good thing, because vaping is more likely to do less damage than smoking a cigarette is. So it's important we move people away from tobacco onto a vaping product. But we don't want to be encouraging more people to actually start vaping anew, or to be new users of vaping. We want people to be swapping from tobacco to vaping.
Right. Mr. Todd, I'm going to jump to you with that. Now, as Professor Johnston stated, that vaping is almost a way to wean off from smoking, and that's what many people assume. But who is the target market here? Because it seems like a lot of people who are vaping are the youth. Many people amongst them are non-smokers. So who is the industry targeting?
Well, actually, if you look at the evidence, that isn't the case at all. There's a House of Commons research paper on it from a few years back, in fact, which suggested it was primarily being used by people who formerly smoked. I myself vape. I've got my vape right here with me, and I was a smoker for 13 years before I switched over to this, and it has made it so much easier for me to quit. I had all the alternatives out there and they did not work. And that right there is the target market, because this is not about stopping people from being able to have nicotine. It is about minimizing the risks involved. Vaping, I believe the last time I looked, is considered to be 96% less harmful than traditional cigarettes, and that's where we need to be looking, and that is what the vaping industry is aiming at.
Right. So you're saying that it's trying to replace the traditional smoking here, but a case that is coming to light is that of the Juul vape device that was stated that its mission statement was to take off people from smoking and get them to use this safer alternative, but it was largely targeting the youth. To that, I wonder, are other companies doing the same?
Well, I don't work for a vaping company anymore, so I can't speak to what they're currently doing. But what I can say is that all our adverts target something, and young people are still smoking. So actually looking at young people and saying, how can we get them onto this safer product is important. But we have to remember, it is a nicotine product. It is regulated, particularly here in the UK. You cannot buy a vape, you cannot buy vape oils until you are over the age of 18. So we're looking at consenting adults. We're looking at people who are able to choose to vape, who would otherwise be able to choose to smoke. So, of course, the industry should be looking at its consumers. And if its consumers are, because let's be honest, an old man who's been smoking since he was 14 and is now into his 65th year isn't really going to look at a vape and say that's something for me. But someone who's been smoking on and off from, let's say, the age of 13 and is now in their early 20s, they will look and say, actually, this is something I can do. This will increase my lifespan. This will help me in the long run.
Right. Professor Johnston, now all this news that's coming in and trying to get to the facts, what do we know for sure? Now, Mr. Todd said that it is better than smoking, and that's what the vaping industry is trying to do, replace traditional tobacco cigarettes. But what do we know for certain that we can say is causing all this hysteria?
Although I agree with what Mr. Todd says, actually the data we have is very thin at the moment because people have not been vaping for long enough and the studies haven't been done. If you think how long it took before we associated smoking with cancer or smoking with heart disease, that took quite a long time to establish that. And I'm sure there are harms from vaping, but I'm pretty sure as well that the harms you're going to get from vaping are a lot less than the harms you're getting from cigarettes, which are still a major killer, even in the United Kingdom, where our smoking rates have dropped dramatically.
Right.
And I don't see just walking around the street, I don't see a lot of kids, children's vaping. So I don't think necessarily that they are targeting at children or very young people. They are really targeting the market, people who want to stop smoking and want a safer product. And I'm convinced that vaping is a safer product, and so are, I think, our Department of Health.
Right. Mr. Todd, now to that same point there, when we're hearing all of this noise, news says they want to ban e-cigarettes completely. Many other countries are putting a ban on vaping altogether. Now, what would you say to all of this? You yourself vape, as you stated. What is your response to all that?
Well, my response to that is actually you should look at the market. There are obviously going to be dodgy discount vape products available on the market that are not necessarily up to the standards we would expect. There are going to be people going out there and buying the cheap vape oils that contain substances which do cause problems. And by the way, I completely and utterly agree with the doctor that actually we haven't had forever to study the effect of vaping, but it is about that reduction of harm, as I emphasized, and it is a safer product as far as we can tell right now. And what they should be doing, rather than banning vaping outright, is saying, okay, how can we ensure that the product on offer is acceptable, that it is doing what we want it to do, which is reduce the harms associated with nicotine intake.
Right. And Mr. Todd, while we're seeing the World Health Organization has also said that there has been a steady decrease in the number of estimated smokers globally. With that, do you think that tobacco companies are now betting their money on the vaping industry? And do you think that the same type of lobbying that was witnessed by the tobacco industry previously will now be seen by the vaping industry as well in the near future?
Well, I'm not a psychic, so I don't want to make a prediction on this one. But where there is a product, where there is a market, where there is big money, there will always be moves towards getting more access for these people, liberalising laws. What I would suggest to any policymakers out there is take it with a pinch of salt, look at it carefully, examine the medical evidence as it is coming. Right now, vaping products are said to be, as I said, 95, 96% safer than traditional cigarettes. In 10 years' time, that may not be the case, but right now the best evidence we have says they are safer. So you should be sort of working to ensure that vaping is available for people. But obviously, sensible limits around the marketing of vaping, not complete deregulation. Just be sensible with this is what I would suggest.
Right. On that point, I also want to introduce another guest joined us, Mr. Mark Meirowitz, who's an analyst joining us from Washington, D.C. Thank you so much, Mark, for joining us. Take us through what is happening in the U.S. in relation to vaping and the hysteria that is being caused regarding it.
Well, but the tendency here, and particularly I actually live in New York State, is the governor of New York has called for the outright ban on vaping of flavored e-cigarettes, and that's probably going to go into effect in New York State within the next 2 to 3 weeks. I heard the last guest in part talking about sensible control. The problem with all of this is that the question is to what extent is vaping really helpful to take people off addiction to cigarettes. And there's actually someone interviewed in the New York Times today who was saying that, if they outlaw vaping, I'm just going to go back to cigarettes. So it's a very, very difficult question, but at least the health officials in the United States seem to be tending towards at least outlawing the flavored cigarettes, but I don't think that affects the tobacco and menthol vaping. But again, this now becomes very suspect. And the big issue in the flavored cigarettes has to do with this vitamin E acetate that's added to it. So I think it's very controversial here, and particularly leading up into a presidential election and election year of 2020, these issues will become very, very significant. And
right.
I think the tendency will be to outlaw them.
Right. And Mark, take us through that point that you mentioned here. With the upcoming elections, these points will become central. And many people are saying that this in itself will have a lot of political impact on Trump's own campaign. What do you say about that?
Well, I mean, the election in this country, in the United States, is really all about President Trump and his foreign policy, domestic policy, and immigration. So if I made a list, I wouldn't put this issue on the top of the list. Nevertheless, I think for Democrats, this is an issue. It's a health and safety issue. And if you want to go beneath the issue, I think you see that it has a lot to do with, with corporations and marketing. And we had the same issue in the United States, similar issue over cigarettes and advertising for cigarettes, where the federal government came along and required that every cigarette pack has to have a warning on it, a health warning. So this issue looms very large, but it's not I wouldn't put it on the top of the list, right. But it's definitely a very salient, very visible issue that's getting a lot of visibility, certainly in state politics here, and probably will be in national politics, I would think, especially because a number of people have died while vaping recently, a number of unexplained events. And that just can't go on. And, the public won't really stand for it. So they're going to want some action on it.
Right. Professor Johnston, going to you, and to make sense of everything from a health perspective, what do you think policymakers should keep in mind and should do when there's political pressure, there is pressure of corporations, there's marketing? What needs to be done on the policy end?
Well, I think certainly here, I would, if I was a policymaker, I would be resisting. I would be resisting a call to ban vaping. I think that's really too early to say that now. What they should do is something at our the equivalent of our FDA, Food and Drug Administration in the UK, which is the Medicines Healthcare Products Regulatory Agency. They actually have a yellow card system where you can report problems with your e-cigarette, so your vaping product. So we need to collect data. If there are problems with particular manufacturers' products, we need to know about those. So if you have an adverse event, you need to report that. And this evidence will accumulate, if there is any evidence, and it will allow policymakers to actually make some evidence-based decisions rather than just a knee-jerk reaction, ban everything. Remember, we're talking about 400 people being affected, perhaps half a dozen deaths. I don't know how many people, just in the length of time we've been talking on this program, how many people have died from cancer-induced or heart disease-induced, cigarette-induced heart disease or cigarette-induced cancer. But I would bet you it's more than 6.
Right. Mr. Todd, on that point, Euromonitor estimates that by 2021, almost 55 million globally, 55 million people globally will be vaping. Now, that's, of course, less than the number of people smoking. But with that, what do you think needs to be done on the marketing end to make sure that vaping is sold as a safer alternative and a safe product, especially when we're talking about trying to wean people off from smoking?
This is actually something I worked on quite a lot when I was in the vaping industry. I would talk with NHS stop smoking services because a lot of them were very nervous about recommending vaping. These are people who don't smoke. They don't necessarily understand what vaping is and how it's different. And, you know, my advice to them was always simple. Find a trusted supplier. Find one of the companies that is actually working rather than the little market trader. Talk to them. They can answer your questions. They can tell you what is in their product, because ultimately, at the end of the day, we need to find a way to curb smoking. And vaping is, to me, for a very personally for me, vaping worked with me. I tried, like I said, everything else out there. But if I had gone to an NHS stop smoking service, I wouldn't have been recommended vaping, and yet vaping is the one thing that has worked. So again, take it all with a pinch of salt, but be willing and open to embrace new ideas, because we can't just keep going with methods that are not working for the majority of people who are smoking. I mean, we've known for decades now that smoking is killing people. So why is smoking not at zero? Right. It's because there isn't another system out there.
And there isn't a system out there, but what other reasons do you think are contributing to the fight against smoking not being as strong as one would hope?
Well, again, speaking personally, the alternative methods to stop people smoking have just not been useful. I've tried the nicotine patches. They just made me angry quite a bit. I tried the chewing gum. It just made me frustrated. I tried going cold turkey. It did nothing. It worked for a little while, and then all of a sudden I was in a shop and I saw a packet of cigarettes and went, oh, and a pack of 20, please. Whereas vaping allows people to sort of continue with the sort of incidental habits, the idea of going out for that 5-minute vape break rather than a smoke break, the sort of camaraderie that you get in the smoking area, talking to other people who are doing the same thing. So it sort of reduces the harms while keeping those normal behaviors, and it allows people to wean themselves off. You can reduce the strength of your vaping product. I use quite a high nicotine content, but I could reduce that at any time and wean myself down to almost none or even no nicotine in my vape, which, hey, that's brilliant. You can't do that with traditional cigarettes.
Right. Professor Johnston, now hearing both of my guests talk about how they don't agree with the fact that the ban is the right solution, and we also see the staunch stance taken by New York and how Trump has also said that it wants to get rid of e-cigarettes. What do you think is fueling for this rhetoric, and what do you think is causing for taking such drastic health measures when the science there isn't proving that vaping is in fact harmful or as more or the same as harmful as smoking?
I don't know why President Trump is concentrating, or politicians are concentrating on this. I think this is a minority issue. It's not a major issue at all. It's just getting a lot of publicity, and perhaps that's why it's being brought to the fore. I'm not here to criticize President Trump, but I think there are other things he could look at that perhaps would be more likely to save lives than changing from vaping or stopping vaping. That's only going to end up costing people's lives, banning vaping. Right.
Todd, just before we wrap up this segment, I do want to talk to you more about how do you think we can move towards correcting the narrative, how we can move towards better awareness, especially when it comes to the youth and those who are first-time smokers or those who haven't been introduced or haven't started smoking. What do they need to learn about vaping and those alternatives?
Well, it comes down to education, as with everything. In the classroom, you can teach people the negatives of smoking. You can teach people the horrible side effects. And we need to be more honest and open about that. We need to show young people that there are horrible things and there are potential risks to vaping as well, so that they understand the risk. But where we already have young people, and it's happening all over the world, young people are still smoking. We have to be honest and admit to that, otherwise we cannot have a sensible policy discussion going forward. Right. Young people are smoking. How do we minimize the risks for them? Well, we have to be honest with them and tell them, well, we introduced quite graphic images on cigarette packets over here, and that has had an effect on people. They don't necessarily want to look at the potential consequences. And vaping, we can say to these people who are already smoking, is an alternative, and that's what we should be doing. Getting stop smoking services to use this as a way in the door, so that people who are smoking can know there are alternatives out there, and hey, we have systems to help you stop altogether. Right.
Mark, just a last question. You now, when politicians talk about stuff like this and taking drastic policy measures without knowing the science behind it, how does that damage health policies? And how do you think that causes people to suffer at the end? As we've seen the numbers and as we've heard both of our guests talk about it, it's not like smoking isn't killing people, it is. Taking away an alternative will just exacerbate the problem.
Well, I vigorously don't agree and disagree with the previous, at least the previous comments. That you simply, gather statistics and this is really an immediate emergency. Look, I leave that to the health officials, to the doctors and the health officials. And if they believe that people are dying and they don't know the reason why, the government, the health officials need to take immediate action. As far as the telling people about the risks, we know, I think, and we know very clearly that the warning labels on the cigarettes have not dampened the desire for cigarettes. I think it's a good step in the right direction. And to be very candid about it, that was a compromise with the tobacco industry. So right now, the question to my mind is, do we have an immediate health emergency or don't we? If we have an immediate health emergency, then the government officials should act on it. And no, we shouldn't spend time collecting statistics and having people call in and tell about the problems that they're having if people are actually dying from it. And that is what the officials here in the U.S. are doing. They're actually calling for a ban. If it turns out that they can figure out the reason and they can ameliorate it, then that's fine. But right now, I think immediate action is what the public wants.
Right. On that point, I think we'll have to wrap it up on that. Thank you so much, Mr. Mark Meirowitz, for joining us from Washington, D.C. Thank you, Harry Todd, for joining us from London, and Professor Atholl Johnson also joining us from London. Thank you for watching Indus Special. We will see you again tomorrow with more stories. Till then, goodbye.